Um, Thank you, moderators, and good afternoon, ladies and gentlemen. It's my great honor to be here to present this topic. As we know, urethral dysfunction and subarachnoid inflammation are important pathological bladder features in both IC and OAB. Inflammatory cytokines and chemokines play important roles in their pathogenesis. So the end of this study is to investigate the diagnostic volume of urine cytokines and chemokines in IC and OAB and to find the potential biomarkers. Urine samples were collected from 98 IC patients, 30 OAB patients, and 28 controls. Commercially available multiplex immunoassays were used to analyze the 32 targets, and the target included inflammatory cytokines and chemokine families and neurotropins. Result: the urine cytokines profiles are different among these three groups. And the cytokines with high diagnostic volume to discriminate disease status, including IC and OAB, from controls included MCP1, MIP1 beta, interleukin 12, P40, and interleukin 7. Among these cytokines, MIP1 beta was the cytokine with the highest sensitivity. The cytokines with high diagnostic volume to discriminate IC from OAB included interleukin 10, eotaxin, interleukin 1 receptor antagonist, rentis, IP10, BDNF, and interleukin 2. Therefore, we design the preliminary diagnostic algorithm to discriminate IC from OAB and controls according to the diagnostic volume. First, MIP1 beta was selected as the screening test due to its high sensitivity to discriminate IC and OAB from controls. The diagnostic rate was 87.7%. Furthermore, cytokines including eotaxin, rentis, and IP10 were used to diagnose IC from OAB, and the diagnostic rate was more than 75%. There are some limitations in these studies. The limitations included enrolled controls, gender factor, individual variation, and the other factors affecting the presentation of urine protein levels. Conclusion: in compared with controls, both IC and OB patients had a different urine cytokines profile, which might reflect their different pathologic condition inside the bladder. And urine cytokines serving as non-invasive biomarkers might have the diagnostic role in IC and OAB. Thanks for your attention.
Thank you. So I had a question on the inclusion criteria. Yeah. So it says in the abstract and in your presentation, IC patients with glomerulations.
Yeah, actually we include the patient according to the ASIC criteria, and the patient was ASIC type 2. It means that with glomerular hemorrhage during cystoscope hydrodetention.
Okay, yeah. But they still had the standard clinical symptoms?
Yeah, fit the clinical diagnosis of IC, bladder pain syndrome, and proven to have the glomeration after cystoscope hydrodetention.
So do you think the presence of glomerulations is important?
Actually, I think that for clinical research to purify the study group is very important, because as we know, IC patient is the composition of IC patient is heterogeneous. So I think that probably different phenotyping of IC patient may have different presentation, clinical presentation, and different urine cytokine proteins presentation. So in this study, we just studied the patient with glomerular hemorrhage.
Any questions from the floor?
It's still that the microphone is up here, so you just have to move fast.
To know if those patients, whether on the side of the control or the side of the OAB or interstitial cystitis, have other comorbidities or take medications, and whether have you controlled this factor in your analysis?
Yeah, actually, IC patients, the IC patient were referred to medical treatment, right? So we collect the urine samples and before the invasive procedure. So this IC patient just treated with with medications. And for OAB patients, all the patients were the medical refractory OAB patient and proven to have diffuse overactivity in VUDS, and all of them were ready for the invasive treatment. So all of these patients would receive the medical treatment, but before the invasive surgical treatment.
Any idea about the other comorbidities, like diabetes, other conditions?
Yeah, it's actually there are many the comorbidity, systemic comorbidity, especially inflammation. Systemic inflammation may affect the bladder condition, but it is actually we have the work these are the work we want to do in the future. Yeah.
Thank you.